my name is Dr. Corinne Howington with Low Country Dermatology here in Savannah. And because May is Skin Cancer and Melanoma Awareness Month, I wanted to give some facts about melanoma as well as some of the risk factors with melanoma. First, I want to go through identification of melanoma or atypical moles. We talk about the ABCDs of melanoma in order to be able to identify maybe a lesion that is at risk for either changing or actually being a melanoma. So the A stands for asymmetry. Asymmetry meaning one side of the mole or the lesion does not look like the other. B stands for borders. The borders can be irregular, jagged as far as their appearance, so you definitely want to look at that. C stands for color. Not necessarily a dark color, but color variation. So you look at a lesion and you see pinks, blacks, blues, maybe even a little bit of brown in there. If there's variable color, definitely wants to send up a red flag and may want to get you to the dermatologist to be seen about it. D, diameter. So a lesion that is 6 millimeters in diameter or greater, which is about the same size as a pencil eraser head. Definitely larger lesions can be at higher risk for changing into melanoma. But even a small lesion, if it has some of these other irregular signs, even if it's as small as 1 to 2 millimeters, can be a melanoma as well. So don't necessarily rely on just a larger lesion. The last one, E, stands for evolution. So if a mole is changing and you feel like it's starting to grow or evolve, then that can be a sign that there is some atypia there. So any of these signs, you want to look at them all together in correlation with one another. But if you notice any of these, it's better to be checked rather than be safe than sorry. So some of the risk factors that are associated with melanoma: patients that have fair eyes, light skin, and light hair. Definitely people with lighter skin are more at risk for developing melanoma. Men are at higher risk for developing melanoma than women. People also that have a history of blistering sunburns pose a higher risk for developing melanoma. Indoor tanning bed use is another risk factor. Some studies that have been done more recently have shown that there's up to a 60% increase in the risk factor for melanoma from this indoor tanning bed use. Patients that have over 50 moles are in a higher risk category for developing melanoma. Patients also that have a history of atypical moles, no matter how many they have, even though they've had a mildly atypical or an atypical mole, even if they only have 2 or 3 moles, still in a higher risk category for developing melanoma.